Okay, let's dive right in. There's this huge paradox we need to unpack. The United States, I mean, one of the wealthiest nations ever, right? It's spending, what, nearly $4.5 trillion on healthcare this year? That's way more per person than any other country, like by a lot.
Yeah.
And yet, you look at the actual results, and millions of Americans skip doctor visits they need. They're drowning in medical debt. And tragically, you hear stories of people actually dying because they just can't afford treatment. It just doesn't add up, does it? Immense spending, but
Yeah.
compromised care for so many.
It really is a central dilemma, a huge contradiction. And that's exactly what we're here to do today. Take a real deep dive into America's, well, multifaceted healthcare crisis as it looks right now in 2025. We'll try to connect the dots, between the system's profit-driven structure and the very real human cost.
Yeah.
So you can understand not just what's going on, but why it keeps happening this way and what it really means for everyday people. We'll look at the system itself, the personal impact, the politics, and maybe what the future holds.
Right, so let's start with that foundation, the thing that really sets the U.S. apart. Unlike most other developed countries, American healthcare is just overwhelmingly dominated by private insurance, by market forces. What does that dominance actually mean, like day to day, for how hospitals or drug companies operate?
Well, it means healthcare in America is fundamentally treated not really as a human right, but more as a business, a commodity. And that perspective, it shapes basically everything: pricing, access, the whole deal. Take hospitals. Many of them now function just like big corporations. You've got CEOs earning millions. Their main goal often shifts, doesn't it? From purely patient care to also, well, maximizing revenue. You see this in things like the charge master, that huge, often inflated list of prices for services. It often bears little relation to the actual cost or even what insurers actually pay. Makes it almost impossible for you, the consumer, to figure out costs beforehand.
Yeah, that lack of transparency is huge. So this corporate hospital approach, plus the power of drug companies setting prices without much regulation, that directly hits Americans in the wallet, right? How does this profit-first idea translate into the staggering cost people face personally?
It really fuels a system designed to extract maximum value. I mean, the average cost for family health insurance, over $20,000 a year now. And that's just the starting point, the premium. Then you pile on high deductibles, co-pays. The numbers are pretty grim. About 2 out of every 5 Americans are carrying medical debt right now. And we hear these stories all the time, don't we? Families facing bankruptcy just from cancer treatments or essential surgeries, people selling their homes, emptying retirement accounts just to cover medical bills. It's devastating.
And the prescription drug situation seems even more extreme. I think I read Americans pay something like 10 times more for drugs than Canadians or Europeans. What's behind that huge difference? Is it just a lack of direct price negotiation?
That's a big part of it. But it's not just the manufacturers setting high list prices. It gets more complicated. You have these middlemen, pharmacy benefit managers, PBMs. They negotiate rebates with drug companies for insurers. But here's the catch. Those savings don't always get passed on fully to you at the pharmacy counter or even to the insurer sometimes. PBMs often profit from the difference, the spread. It's another layer that's not very transparent and can drive up your out-of-pocket costs. So you combine that murky system with the fact that the U.S. government is basically banned from negotiating Medicare drug prices. And yeah, it makes that phrase, GoFundMe as America's healthcare safety net, feel painfully true for a lot of people. It really shows the struggle.
It really does. It highlights the sheer desperation. And it's not just financial, is it? For millions, it's about not even being able to get care. Which brings us to this huge issue of unequal access. Some people get world-class care, sure, but others are left completely behind. Like we're seeing rural hospitals closing constantly. What does that do?
It creates this stark divide, what people often call two Americas, right? One America has access to the best doctors, the best treatments. The other, often in rural areas or maybe underserved inner cities, they might have no local doctor at all, forget specialists or even a nearby ER. The consequences are, well, exactly what you'd expect. Delayed diagnoses, worse management of chronic illness, preventable deaths, and these gaps aren't random. Poor communities, minority communities, they bear the brunt of this. Black, Hispanic, Native Americans often have significantly worse health outcomes, less access to preventive care, higher rates of chronic conditions. It shows just how deep these inequities run.
And all these personal struggles, these deep inequalities, they inevitably boil over into politics. Healthcare is always a flashpoint in Washington.
Yeah.
So you have Democrats generally pushing for universal health care, right? Ideas like Medicare for all, expanding the ACA, trying to get drug price caps. What kind of models are they usually looking at for things like price caps? What's the core idea there?
Yeah, when Democrats talk about drug price caps, they often point to countries like Canada or in Europe, places where the government negotiates prices directly. They use their national buying power as leverage, basically. Some proposals here suggest letting Medicare negotiate prices for everyone it covers, similar to how the VA already does it for veterans. That's currently illegal for standard Medicare, though. The core argument is always that health is a public good, that government needs to step in to ensure fairness and affordability, to stop the market from failing people.
Okay, and then on the other side, you hear Republicans warning about socialized medicine, about government getting too involved in health decisions. What's the foundation of their opposition? And who are the big players influencing this constant debate?
Well, Republicans tend to frame it as an issue of individual liberty. They argue for market-based solutions, believing competition drives innovation and efficiency. The concern is that government control will lead to, well, bureaucracy, maybe long waits, maybe lower quality care. And behind this whole debate, you have incredibly powerful forces. Lobbyists from the insurance industry, from the pharmaceutical industry. These groups spend literally billions every year trying to block reforms that could dent their profits. They often argue, for instance, that price controls would kill the R&D needed for new drugs. They are a huge, huge factor in Washington.
This constant political deadlock really stands out when you look globally. It's just striking. America spends so much more per person, yet ranks lower on things like life expectancy, general health outcomes. It's a massive contradiction.
It really is quite something. Think about Canada, the UK, France, Japan. They all have some form of universal coverage. Their citizens generally live longer, healthier lives, and they manage it all for significantly less money than the US spends. It just raises that fundamental question, doesn't it? Why do Americans put up with a system that seems, frankly, so inefficient and unfair compared to others? Part of it might be cultural, that deep-seated suspicion of big government,
Hmm.
which is really different from how many other countries see it, where healthcare is viewed as a basic public service, a right, not just another product in the marketplace. It's a really fundamental philosophical split.
Let's dig into the drug industry specifically for a moment. Big Pharma is consistently one of the most profitable industries anywhere, year after year.
Absolutely. And here's an example that really makes you stop and think. Insulin. Basic insulin, it costs maybe $10 or so to manufacture a vial. Yet in the US, that same vial can sell for over $300, sometimes way more. That's the reality. For many patients with chronic conditions, it's literally pay or die. And again, you have the industry lobbyists fighting tooth and nail against any attempt to regulate those prices, keeping profits high. It's also worth remembering, for our listeners, that while companies say high prices fund R&D, studies often show a huge chunk of their spending actually goes to marketing, administration, lobbying, not just research. And, a lot of the initial groundbreaking discoveries actually come from publicly funded research anyway. Companies then license it and bring it to market, often with huge markups once they have a patent.
Wow. So it's a really tangled web.
Yeah.
Pricing, profit motives, lobbying power. But behind the numbers, behind the politics, behind the industry tactics, it's always real people, isn't it? The human cost just feels immense. You hear these awful stories. Parents skipping their own meds to afford their kids' treatment.
You do. All the time. Seniors cutting insulin doses, trying to make a vial last longer, sometimes with fatal results. Even military veterans who you'd think would be covered, struggling to get the care they need and deserve. These aren't just sad anecdotes, they're signs of systemic failure. They really paint a picture of the massive emotional and financial stress this system puts on ordinary Americans. It makes you ask, what kind of society are we building when basic survival is tied to these impossible financial choices?
So looking forward, the choices seem pretty stark, and the stakes are incredibly high. Will America eventually move towards some kind of universal coverage like those other developed nations, or just keep going down this road? We are seeing things like telemedicine grow, AI, and healthcare. Those offer possibilities, and there's always talk about expanding Medicare or Medicaid. These tech advances and policy debates are definitely part of the mix now.
They are. And connecting this to the bigger picture, you have to wonder, could the current private insurance model just become unaffordable for too many people? Could it start to collapse under its own weight? The choice America faces seems pretty clear in the next few years. Either undertake significant reform, maybe move towards a public option, or something more universal, or, risk the system crumbling further and deal with the escalating human cost that comes with that.
So circling back to where we began, you've heard the story. The U.S. spends more, people suffer more, and often die younger than in almost every other wealthy country.
Yeah. And this deep dive really shows, I think, that this healthcare crisis isn't just about medicine or spreadsheets. It's deeply about morality, about our values as a society. It forces us, all of us, to confront a really fundamental question about who we are as a nation. Should decent healthcare be considered a basic human right available to everyone? Or should it stay a privilege reserved mainly for those who can afford the high price? That's really the question for everyone to think about as we look ahead.